Do you know that one in 3 to 1 in 4 nursing students will not complete their degree? Evidence suggests that nursing has the highest dropout rate, which 25 to 33% of students actually not failing to complete their degree. Hi guys, welcome to the channel. My name is Shola, and in case it's your first time of seeing my face, on this channel we look to bridge the gap between nursing and finance. And the aim of this channel is to support nurses, either qualified nurses or student nurses, through their journey. We also aim to talk about finances. We look at things such as your payroll, your pay slip, and many more. So if you get any value from this video, please don't forget to like, to share, and to subscribe to this channel. So in the UK, the nursing degree is about a 3-year course, which combines theory with practice. So you've got 50% theory and you've got 50% practical. What that means is that theoretically you'll be attending classes, and also you'll be completing essays, assignments, and in your final year you'll be completing a dissertation. On the practical side, you'll be attending placement. So this could be school placement, this could be placement in a nursing home, placement in a psychiatric inpatient setting, or placement on a ward. So that equates to 50% of the practical aspect of the course. Then that means that you'll be going to class for 2,300 hours, and also you'll be going to placement for 2,300 hours. So in this video, I'll be telling you some of the reasons why nurses drop out in a nursing degree. And the first thing I will talk about is the intensity of the course on its own. When I say intensity, I mean that you need to complete, go to classes, complete your assignments, complete your dissertations, and also go to placement and complete 2,300 hours of practical work. Okay, the intensity of that alone means that people will drop out of the course, and because of the level of work that is involved. Secondly, the next thing I want to talk about is the age of the students. The average age for nursing students is about 30 years old, so you've got more matured people going to the course, and these matured people are likely to have mortgages, they're likely to have childcare issues, and also they are likely to have obviously another job which they have to do to earn some income. And because of that, the workload might mean that these mature students might struggle, either because they struggle to pay their mortgages, they struggle with childcare, or they're struggling to fit in their day-to-day job. And that also takes me to the next point. The next point is finances. Okay, most nurses or nursing students ranging from age of 18, 19 to 30 might struggle to live on the bursary that is being given by the university, or the bursary that is given to student. So financial issue also plays a very difficult part. Another thing I want to talk about is the experience. Most people go to uni to have a positive experience. They might be looking to make friends, to integrate with different people, and also to be able to go out and enjoy themselves. With nursing, it becomes difficult when you have to attend placement, and you might find yourself struggling to keep up with your colleagues because some people are school leavers, probably 18, 19, 20, who want to have a full experience of nursing by either spending some time in classes and also going out with their colleagues. But when the placement comes and they have to attend the placement, it's like having 2 or 3 different jobs. So these are some of the reasons why nursing have a high dropout rate. The next issue that I want to raise is that of bad experience during placement. When students go into nursing, they don't really have a choice as to where they go for placement. So you might have worked as an healthcare assistant on the ward, and you prefer to work with children. When you go to university to study a 3-year course, you will have to do placement across the board. So you'll have to go to schools, you'll have to do community placement, you'll have to do ward placement, you'll have to work with forensic patient, you will have to work with cancer patient, and also the elderly. So with the degree, you don't have a choice as to where you go. The aim of the course is to give you a full round experience of nursing, and because of that, people might have bad experience. For example, you might find yourself looking after the elderly when your preference is working with children. So as a nurse, you have to be an all-rounder, and you need to be able to maintain that during your 3-year course. So this also contributes to the dropout rate in nursing. Another thing that I need to, another point that I want to raise is that sometimes during the course, some students have ill health. In this situation, there could be issues with their mental state. There could be also issues with their physical health. Some of this mental illness or physical illness might be brought upon by the course itself, and the course itself might affect your mental health, or the course itself might affect your physical health, where you find yourself perhaps going through some degree of anxiety or going through some physical health illness. So that is also a contributing factor to the nursing dropout rate. Another reason for the high dropout rate in nursing is that some students are practical and not theoretical. What that means is that when you put them on the ward, they can function very well. But when it comes to theoretical aspects such as writing assignments, writing essays, writing dissertations, they might fail in this situation, and because of that, they might drop out of the course. Again, the nursing degree is looking for an all-round student, somebody who is able to produce results theoretically and also practically. Finally, the last point that I want to raise is that sometimes along the way while doing the 3-year course, some students might have a realization that the course is not for them. So these are some of the reasons why nursing has a high dropout rate. So, putting it out there, what are some of the things that we can do to reduce this dropout rate? I think robust financial support for nurses is important, and I think again having that support either physically or emotionally is very important for nurses. I believe that there's some apps out there that support nurses and allow nurses to be able to put out their doing in placement so that they can actually receive the right support at the right time. What I want you to do with this topic is to engage with me in the comment section and tell me, what can be done to reduce the nursing dropout rate. As you're aware that nursing in the UK there's a massive shortage of nurses, and it's very important for us to do everything that we can to ensure that those students successfully complete their 3-year course. So thank you very much for watching this video, and again, don't forget to like, to share, and to subscribe to the channel.